Immune checkpoint inhibitors have already superseded chemotherapy in the platinum refractory setting. They are also now being used in the frontline setting in individuals who are not eligible for cisplatin-based therapy. And so there's been a huge landscape change in that respect. And I suspect this change will continue. We have 4 or 5 frontline trials looking to completely replace chemotherapy, either with chemotherapy and immune combinations, or immune-immune combinations. One of the challenges is based around, number one, can we select patients better? Remember, as it currently stands, only about 20% of patients are going into long-term durable remissions. We can select patients better with a biomarker. We don't currently have good biomarkers. The second question we need to answer is around combinations. Can we increase the efficacy by using immune combinations, chemotherapy combinations, or targeted combinations? And all 3 of those are being tested. And the last question is whether or not we can ask a different question, bring the drugs earlier into the perioperative space, looking at adjuvant and neoadjuvant type studies to try and improve cure rates. So it's a huge amount of work going on in this field, particularly bringing the drugs earlier, improving the biomarkers, and using combinations.